Hello and welcome to Community Roundup. I'm Munjal Yagnik. In tonight's show, we continue our coverage of Pravasi Bharatiya Divas and Wharton India Economic Forum. Parekh Family Foundation to host U.S. Indo Foot and Ankle Surgery Conference in New Delhi. And we'll look at a Lodi celebration held at the Durga Temple in New Jersey. All this and much more, but after a short break. The Parekh Family Foundation is a U.S.-based nonprofit that works to educate people about foot and ankle pathologies, decision analysis and surgical techniques in India. To work towards this cause, in 2010 and 11, the Parekh Family Foundation hosted a U.S. Indo Foot and Ankle Surgery Conference in Mumbai and Coimbatore. This year again, the foundation's co-founders will be traveling back to India to educate people in New Delhi from January 20th to the 22nd. The course will bring together the expertise of 4 U.S. foot and ankle faculty members with the experiences of 3 to 4 Indian foot and ankle surgeons. The course will be held at the Max Hospital Center in Delhi. This year's course is of particular interest as it features a total ankle replacement surgery being performed. We spoke with the co-founders of the Parekh Family Foundation to learn more.
The Parekh Family Foundation was started approximately 3 years ago with the hopes to increase the awareness of foot and ankle and medical problems that occur in India. My parents were immigrated to this country in approximately the 60s, and they had very strong traditional beliefs. My brother and I were both raised with those beliefs, one of which was to give back to our home country. So the foundation was formed as a manner to give back to India. So foot and ankle education for kids is available in India, and there are conferences held regularly in India. But for the adult foot and ankle problems, there is no dedicated conference or meeting to educate the Indian orthopedic surgeons. This is the only foot and ankle course of its kind for the Indian population. Orthopedic problems can occur related to sports injuries, can be related to arthritis of the hip or the knee. Patients can have spine problems. They can have trauma from car accidents or falls. Those things are very well handled by orthopedic surgeons in India. In addition, people can have problems with their foot or the ankle. These are the problems that go largely neglected in India by the orthopedic surgeons, not because they don't have the surgical skills, but because they haven't been shown the techniques and ways to treat these problems. This course tries to bring that education to the orthopedic surgeons. When we do an ankle replacement, we go into the ankle joint, we cut out part of the ankle and we replace it with metal and plastic. So if you look at this model here, this is a model of a leg bone and the foot. The ankle sits right in this area here. Those patients who have ankle arthritis do not have any joint left in that space. With our surgery, we cut out part of the ankle and we replace it with this metal, and the metal on 2 pieces and the plastic. This allows patients to have motion at their ankle joint, which they did not have with ankle arthritis. Without this surgery, the only real solution for patients is to either live with the pain or to get an ankle fusion. Now, an ankle fusion is where we lock the ankle into place so there's no motion whatsoever at that ankle joint. We provide charity surgeries, so we will be doing this total ankle replacement free of cost. There will be, our surgeons go to India and we perform charity surgeries. There's no charge to the patient.
I actually really love to do this. Not only does it help me support his career, but it also helps me keep going with my career. Since I'm a physical therapist, this is stuff of very good interest to me, and it also helps me to keep my wheels turning and work like a well-oiled machine together. So I actually enjoy it quite a bit. So actually I do the physical therapy and the rehab portion of the meeting, so I will tend to give talks every meeting that focus a lot on different protocols for different surgeries, what the rehab portion is going to be, what their treatment is going to be afterwards, and then I also give some information on all different modalities that can be used in the rehab portion. because this is something that the doctors there and the physical therapists there really ask about, and they want to learn more, especially with the advanced techniques that we have here in America, and the advanced protocols as well as the advanced equipment that we use for therapy.
And it's time for another break. We'll be right back.